I'm Noreen Ellen Schwarten, and I live in Emerson, and I'm married to Edwin Schwarten. That's an old family in that little community.
Ellen and Ed Schwarten are world travelers.
We just enjoy life, and now I've been given some more time by having this procedure, and I'm really happy about it.
How are you?
Great, fine.
Okay.
Thanks to you.
Ellen's doctor had diagnosed her with aortic stenosis, or a tightening or restricted opening of the aortic valve in the heart, several years ago. And when it came time for Ellen to have that valve surgically repaired, it was suggested the TAVR, or transcatheter aortic valve replacement procedure, was right for her.
It's a percutaneous technique where we replace the aortic valve by inserting plastic tubes into the groin arteries. And basically, a new valve is mounted onto a balloon. And it's basically a fancy procedure for stenting the old valve and deploying a new valve immediately that's immediately functional right at the time of the procedure.
This procedure is relatively new, created in the last decade, and is an alternative to an open heart procedure. TAVR is done while the patient is awake, and recovery time is much shorter.
This is the valve.
Patients are usually minimally sedated, and if they are intubated or put to sleep, they're extubated right after the procedure. So it's generally a much shorter length of stay and greater patient comfort. The recovery is sooner. Patients can return to their usual activities in a much shorter time frame.
So here I am, feeling good and got a new valve.
When I met Ellen and Ed, Ellen was 1 week post-TAVR procedure.
But I was awake during the whole thing. I was not put out. And it's better if you can do that. And I did that. I heard them talking and everything.
The TAVR procedure is quick, taking around 60 to 90 minutes. And patients like Ellen are home in a day or so. A much better alternative to the lengthy stay and recovery that comes after an open heart procedure.
If you look at the number of open heart procedures or valve replacements being done nationally, 10 years ago, 80 to 90% of the open heart valve procedures were done surgically. In 2020, that's about 50% being done surgically, and the other 50% being done via this transcatheter technique called TAVR. You were an amazing patient.
Oh, thank you. I didn't think that.
Just 1 week after her valve replacement, Ellen was doing great. She showed me the 4 electrodes she has to wear 24/7 for 30 days to monitor her heart and any episodes or events she has. Doctors at MercyOne have been doing the TAVR procedure for about 18 months. And with patients like Ellen, they see just how significant an impact this less invasive procedure can have on someone's life.
Where I would think that if nothing was done, that my life would be shortened. I think I got a few more years. I'm 87, and so I'm thrilled living that long,